Hi, Jason at OKC Kids Urology here. Wanted to talk to you again about how to survive the hospital stay when you've got a surgery that keeps you there 5 days a week, maybe even longer. And again, how to keep your child entertained and as well as you. I think one of the biggest challenges for kids, and again, the age range here could be pretty wide. It could be anywhere from their initial closure surgery at about 1 year or possibly a little less, all the way up through a 10, 12, 15-year-old who possibly had a bladder augment, a stoma, whatever the surgery might be at that age. I wanted to let you know a little bit about my personal experience with my bladder exstrophy son. His most recent surgery he had right before he turned 8. It was the bladder ligation, the augmentation, the stoma, and the ureter reimplantations. And he did really well. We were really pleased with him. Typically, we're not big fans of giving our kids electronics or things that are highly stimulating, except for once in a while here and there. But at the same time, when he was in the hospital, the goal was for us to give him an opportunity to heal and to rest and not go completely insane just from boredom. And so in our room here at Integris at the hospital, they have PlayStations in the rooms with certain video games. We brought a tablet and a laptop as well. So he had an opportunity to watch video games, play video games, to watch TV, shows, movies, as well as whatever just kept his interest. And we also brought books and things because he does like to read as well. But as you know, your kids would much rather play video games than read most of the time. The reason I bring this up is because there's an interesting study done maybe 10 or 15 years ago involving children who were in the hospital and what their pain tolerance was like. I know that as parents, we don't like to see our kids in pain. That's probably one of the worst things for us to observe, because I know that any parent would love to just take on that pain for their child so they wouldn't have to experience that. Unfortunately, we don't have that option. However, one of the things that we can do is provide as much relief as possible. So the study that I want to reference had to do with two particular groups of kids that were studied after surgery, and it had to do with their pain levels. The first group was given narcotics as needed, as well as things like Tylenol and ibuprofen to help manage the pain, and they were given no electronics. And then the second group was given only electronics and Tylenol and ibuprofen, but no narcotics. And the reason I mention this is that some of you as parents may have a kiddo that is highly sensitive to maybe Tylenol or even Vicodin, Norco, those types of heavy narcotics that we often use to minimize and numb pain for people right after surgery. And so the study really showed, at the end of the study, they showed that both groups that were given either electronic devices or just the narcotics, they reported the same level of the amount of pain at the end, which indicated that those who were given screens, every time you look at a screen, your brain gives you a release of dopamine. Now, dopamine is that happy, feel-good chemical that we get when we consume alcohol, we eat chocolate, we do other things that are considered pleasurable, right? So that's what dopamine is for. So we look at a screen, we play a game, we play video games, this is what your kids do, dopamine gets released. Dopamine is also that feel-good chemical that says, give me more, right? So once your kid starts playing video games, they don't want to stop because they keep getting that pleasure center. It keeps just releasing and releasing, and it feels good, right? So that's what's addictive about dopamine. We all know narcotics are addictive as well. However, it is a chemical that comes from outside of your body and is unnatural, is manufactured, and all those things. So all that to say, if you do have a child with some sort of medical, chemical, drug sensitivity, this is why we introduce screens. Now, again, outside of the hospital setting, screen time, I believe, should be generally limited and used very carefully. At the same time, when you're in the hospital and you're just trying to get through a really hard week of pain and suffering, it is, in my opinion, it can be really useful to have your kid be distracted by these multiple different things. It's good to have a variety of things to keep them occupied because they literally are laying in bed almost 24 hours a day. So whether they're playing a video game, a tablet, a laptop, watching shows, I think reading books is great. Just helps keep their brain interested in a healthy way. Coloring, sometimes school work, even though that's not fun. But just to keep that variety going is also very helpful. So all that to say, it is possible. You can survive through that. Your kids can survive through that. Just think of the variety as well as the pain management aspect. It doesn't just have to be morphine and narcotics and things like that. It can be non-narcotic oriented. Actually, Austin, my son, one of his claims to fame is that his most recent surgery that I mentioned earlier, the entire surgery was done without narcotics. And his pain level was quite manageable. It was obviously difficult the first 24 to 48 hours, but we did give him pretty much IV version of ibuprofen, and he did great. So as you guys already know, as parents, your kids have an incredibly high pain tolerance, whether they want to or not, but they are capable of getting through it. So just want to put that out there, give you guys some ideas to think about, and if you have any questions or comments, feel free to email me or call me through our app. All right, thank you.